First of all, certainly it was something in the waiting. I don't think we are going to say that we are going to go through all this COVID period and expect no death at all. Certainly we knew a death will one day occur. Even the president said it, by the way. He said, you are going to see deaths, and these deaths are going to happen. You cannot go. I think God had helped us, and all the efforts we made as a country, and that's why we have reached 1,079 cases without a single death. So now we have got the death, but we anticipated the death would occur. As we told you, 20%, 15 to 20% of cases progress to severe and critical. And once you get to severe and critical, most often, most likely, you will lose a few of those who progress to severe and critical. So even as we knew at one point we'll lose some patients, and we've been prepared for that. That's why you see we have prepared ourselves to manage severe and critical cases by especially having all our regional referral hospitals prepared to manage severe and critical cases. So if you, that is even related to question number 5, that are you worried as a country that this is happening? Of course it's not, it worries us, it has happened, we were happy, we are going very well without any case, but it's something we knew would happen because it is inevitable that it at one point it would happen. So we are ready for that. And then there was also a question that this is a perfect timing to relax restrictions or tighten them. Me, I think now the message is people were thinking that the COVID in Uganda is not killing. Now we have seen it is killing. So what is important now is to be very serious and very strict and make sure that we abide by all guidelines that are being provided, especially those people who are not serious with the especially social distancing, washing their hands, and all the other preventive measures. So this is the time not to relax, but maybe, not maybe, but to be even more serious with all those preventive methods which everybody has been singing about, including none other than His Excellency the President, all the preventive measures. And we request you as the press to help us to go and amplify those messages even more. Initially, we thought he was a Kenyan. Initially, you want to explain that? Initially, we were given information about that he was a Kenyan.
Enter. Most likely, yes, because we are seeing a constant increase. Some of the weeks we see between 25 to 35% increase on the previous week. So we are still climbing at semi-exponential level, which is worrying. As you know, the world is approaching 15 million, at least up to what is reported to WHO is only shy of 30,000 from 15 million with 620,000 deaths. As far as the African continent is concerned, we are approaching 750,000 with close to 16,000 deaths. And the only 2 countries which didn't report death in Africa are Eritrea and Seychelles, but we are talking about relatively a small number. Eritrea has confirmed 251 cases, and Seychelles and 108. And looking at testing, I think Uganda should be congratulating itself. It's one of the countries which has one of the highest tests next to some of the other countries, South Africa, Morocco, Ghana, Ethiopia, and Kenya, which also have significantly higher cases. So You asked a question about lockdown. The government has done a gradual, in Uganda, a gradual easing of lockdown. This one death might not indicate that we need to go back. We should look into the overall picture. Are we getting more cases? Are we getting more severe cases? How is it related to the Uganda's capacity to treat, to its number of ICU beds, number of physicians, number of commodities, and so forth? And that will determine what the government should do. But also, as you have realized, is all these cases are not happening everywhere in the same level. So we have to look into where are the hot spots and what are the measures which has to be there. And I could say that I congratulate Uganda because the effort it has done has paid off. And with the population cooperating, I think Uganda can do better. But as I said, the most significant and the most important aspect is the community following public health preventive measures, wearing masks, physical distancing, hand washing, and all the other messages which are coming from the government and from the scientists are important, and we have to follow them if we don't want the number of diseases to rise from one to other numbers, and for the number of cases to go from 1,100 to 100.
So the problem is when people pick the figures, they just pick figures and they do not tally it with the explanations given down. So like we gave a figure of the cases we have, and then we gave the figure of the recoveries. And in our notes, we indicated that the recoveries include Ugandans and the foreign truck drivers who were sent back home but are not included in our list, in our tally for positive cases. But somebody who picks it does not pick that explanation, just puts there Uganda, cases positive, recoveries. And then people started mocking us and saying we have -2 what? They called it -2 cases because the recoveries were more than the positive cases. But in our release, we had given the explanation. But the information which was being given internationally didn't capture this explanation. So our information looked like a mockery, really. So for that matter, we said, for that matter, we shall only be giving information which shows our positive cases and our recoveries and those who are still admitted. And if you look at that now, if you look at our positive cases, you look at the people under treatment, the Ugandans, and those we have discharged, they tally. But for purposes of our records in our tally sheet, we know how many people have been sent back to Tanzania or Kenya. We know who went back, how many went back to Elegu. We know how many we treated within Uganda and we discharged after treatment. So that information we have. But for releases, we shall be giving you what is for Uganda, treated, recovered, and still admitted, to avoid that sort of confusion. Then as far as Namsindo is concerned, I think the incident commander will add on this. We have already told you that they have been reporting very well, and they have been showing us the number of cases, especially the alerts they were getting, and mainly the alerts since May, where we had 86 in May alerts, we had 72, and we had 105 in July, 72 in June. And they have been reporting very well every month, and their reporting rate actually is 100%, and they've been calling in. But of course, as we told you, that's why we're emphasizing that Namsindo is a border district with quite a number of porous borders. So it is also possible that a few cases could have been coming in from Kenya undetected, But the cases they detected, they always quarantined them. But it is possible that a few cases could have come in undetected. That's why we have sent there a team to do very, very vigorous surveillance, especially any cases within the districts that could be there.